There are special guidelines for the dentists. They have to be very careful where they get the injection. If they get the injection in the muscle area, they can cause damage to you. If you open your mouth too wide, too much, they can cause damage to you. If they leave it for too long, they can cause damage to you. So again, any dental procedure, caries, anything, but दांत का कुछ भी करवाना है तो डॉक्टर को समझाना होगा. वो आपका गाइडलाइन जाके दिखाना है कि दांत में वो जब करता है तो इंजेक्शन लगाने के टाइम में बहुत ज्यादा मुंह खोल के या बहुत ज्यादा देर तक मुंह खोल के वो बच्चे का जॉ को हानि दे देगा. बच्चे को जॉ को हानि हो जाएगा तो मुंह नहीं खोल सकता है. तो इसलिए वो बहुत जरूरी है कि डेंटिस्ट को भी समझाना. तो आप गाइडलाइन हमेशा अपने साथ रखिएगा, अपना फोन में. Yeah. So he will. I think one dental doctor is going to come in the evening. So he will have a look. He will explain. And even if you are doing it in your place, let your dental doctor talk to this dental doctor and advise. Because there are 3-4 precautions they have to take. But if he's having cavities, we have to take care of that also. Because we don't want too many dental operations. We should avoid sweets, washing the mouth after eating anything, brushing in the night. All that will also be good dental care. That also वो डॉक्टर बताएंगे. शाम को एक डॉक्टर दांत वाला है. So any other way, if they are playing too much, sometimes if the children are playing so much that their bone joints start hurting, their muscles start hurting. So if any time they reach the stage when their muscles are starting to hurt, that means they've done damage to muscle. That muscle can form more. Okay. So that's one more thing. Okay.
So doctor, regular walking.
No, that doesn't do anything. It's when you tire it so much that it starts paining.
Right. So it doesn't happen in normal course.
Normal course. Like painting a wall.
Yeah.
We have seen patients coming back with severe swelling in the arm. So normal person will get swelling and it will settle down in 2-3 days. But if an FOP patient tires it so much that he gets swelling, he definitely get.
So if you cause trauma by doing excessive muscular activity, then it can.
High muscular activity, like running a marathon normally.
Right.
Very unexpected running, long distance, that will cause
tiring. If they walk up the stairs.
That is not. Normal activity, no problem.
Okay, that is not traumatic.
No, it is to be encouraged. Normal activity. But abnormally high activity, which they are not regularly used to, will cause them to develop suddenly.
Okay. What about cold and influenza virus?
So we are coming to that. That is the next one.
Madam, here she said writing for a long time, having some pains.
Writing usually no, unless she's writing a 4-hour exam or something. They only 3-hour exam. CBO. She just needs to write slow. She has problem. Writing no, they don't have.
And they sit on one side for too long, because they are not able to sit normally. Right?
I think that is coming under pressure source.
Yeah.
So sitting for too long comes under pressure source. So then we can talk about precautions.
But that does not cause the ossification.
No.
Because one part of the muscle is caused.
The problem happens, that won't be muscle, that will be bony points which will cause pain. Because it's the bony points which cause pain.
Okay.
So I think now all of you know how to diagnose. If you have stiffness and bony swelling on one side, and if you have toe deformity on the other side, and anybody who has got both, then we have FOP. And we have to make sure that everybody who deals with us, who touches us, who does any kind of intervention on us, understands that whether it's a PT teacher or the school teacher or the doctor, everybody should be aware of it. The more we make people aware, the safer we become. Otherwise, the other people will make it unsafe for us. Now, all of you know that we have a gene test. So sometimes it may be difficult. Like a newborn child, I don't have any swelling, I don't have any stiffness, but I have only toe deformity. We had a child like that who came for correction of toe deformity. But that is the time when a gene test is most helpful. If the child has already developed deformity or swelling, then the gene test may not be required, but you can confirm it. But most of the people, 97% of the people, have same gene problem. It's not a different one, and that's the name we have given. It's the ACPR1 gene. And anybody who has not had a gene test done, and they want to do it, Miss Agnes is the scientist. She can do the gene test for you. So if you haven't had it done, you can get it. So that is why I'll come to that. But anytime anybody takes blood from you, they have to do it only into the vein. They should not go on poking the muscle and everywhere to take the blood. Into the vein, then we go.
Doctor, it is a little difficult to understand that particular allele and the other mutations. In what way can we kind of interpret?
There is only 97% of Indian population have this C1067.
Yeah, so that one, I'm not able to understand what an allele is.
No, so usually we have two genes. One comes from the father, one comes from the mother. So they've got alleles. So usually you need only one to be abnormal. That is why we call it autosomal dominant. If one is abnormal, then that is the cause. And then commonest abnormality that we have is the C617, G2A or 2C006H. That is the name. It doesn't matter, it's just a name or a number. All the other two genes that we have found in our population are those other than the name.
And what is the manifestation, the two other mutations?
So one of those mutations, 983G2A, that one is different from this. They have last bits of their fingers are missing. Yeah. They're not short, they're missing.
Both of them?
No, the last one.
The last one. The other one?
Other one is similar. So I just want you to understand that there is a temperature gradient. Hotter to cooler. So as we go towards the leg, it is cooler temperature. As we are in the body, the temperature is hotter. That most probably is the reason why the hotter or more inflamed, the temperature seems to determine where we get the ossification. So the more heat in the central areas, so those are more heat in the back compared to the front, so the back gets affected. Front compared to the front.
Is it related to blood flow, doctor? Is the way the blood flows more?
It's just the temperature gradient. These are the normal temperature gradients
in the body.
Most probably better blood flow in the trunk than in the extremities. So that's why this takes longer to get in body. So some joints, like I explained, will anyway come. That will come, maybe slow, maybe faster, but they are almost constant with age, like neck, back, shoulder, elbow, ankles. They come in increasing age. Some other ones like like jaws, hips, wrist, and knees, they increase as the age increases. Then one of the way the progression happens is with flare up. So some people, very few people, they just slowly develop, and you don't notice it till the whole back is stiff. So it comes slowly, it keeps growing, and you think my child never had anything to the child is protein, because the child is very adaptable. When they get a little stiff, they'll adapt to that. More stiff, they'll adapt to little more stiffness. So they'll never complain, and you won't notice. Okay? So that kind of thing comes very gradual, very constant. वो तो उसको धीमे-धीमे आता है, पता नहीं चलता. और जो दूसरा कुछ होता है, जैसे कि जॉइंट में, बड़ा जॉइंट में वो फ्लेयर अप करके आता है. So if you get flare up and come, then at least you know that it is coming. So that means if we are going to ever have medicines for that, we will have to have two types of medicine. But one which is given all the time to stop the progression, and the one which we have to give extra dose, or the same medicine extra dose, and we get flare. So what causes flare up can be trauma, and it can also be infections. So we get viral fever, high fever, any kind of an inflammatory reaction anywhere in the body. That can set up, so that even fever can set up that. So if you get flu, and with the flu you get high grade fever, you can get a flare.
Once he was playing and he got a scratch and he started bleeding. Then after that, bleeding stopped, then the wound was completely okay, and he got a bone like structure, and then it went up. So does it come back again?
No, if it is gone, so most likely he got a small area which was inflamed under the skin, and that did not convert to bone. That is all that happens.
So there are no chances it can come back.
No, once it goes, it is not coming back.
So which one will, which flare-up will become bone, which one will resolve?
Nobody knows. That we do not know. So I think one of the things that you can get is either partial or complete response to steroids. So steroids is prednisolone tablet that we give you. Everybody knows that you have prednisolone tablet. Do you keep it with you? Keep prednisolone tablet with you. You don't have it. Yes. You have prednisolone tablet with you. Keep prednisolone tablets. So I want all of you to keep prednisolone tablets with you. I tell you why I want you to keep it. Is by the time you ask me and I send the medicine, 5-6 days, 1 week will be over. By the time it will not have effect. It might decrease the pain, but if you wanted to decrease the flare up or decrease the bone formation, you must give it within 12 hours. That is why most of the results with the prednisolone also, there are very mixed results. They are saying that it decreases the swelling, it decreases the pain, may not decrease the flare up because unless the timing is very quick, the damage is already done. So please keep it with you. If you see the flare up starting within 12 hours, if you want to start, you can abort this flare up or you can make it partial instead of having a full flare up. So this is very important. Another thing I want to tell you is that sometimes when we have the flare up, there is pain and then the leg is put in a normal position. So when the leg is in the abnormal position and the inflammation forms in the abnormal position, same thing with the hand, you may keep like this because of the pain. But once that opens, it is not going to straighten out again. So what can we do to prevent it? We know which is the best functional position. So if you are going to be having a flare up during that time, you can actually make sure that your limb is in functional position. So hip should not be bent like this, but hip should be straight. Hip should not be going like this, but it should be like in neutral position. It should be straight and in neutral position, then we can walk with it. Okay, but if you let it bend to 90 degrees, we will not be able to. So during the flare up, as far as possible, make sure that when the child is resting at least for 16 hours a day, it is kept in neutral position. Everybody understanding that when you are having flare up in a particular joint, okay, keep the joint in neutral position. Neutral position means the position where you want is the best function. So for the hip and knee, best function for walking is straight. So keep it straight. Don't allow it to bend like this, or don't allow it to go like this. Okay. Same way for the hand, don't let it become like this because then you can't. Keep it little like this. So if you like this, you can use the hand. So yes. So when you're having flare up, you don't do passive exercise. Don't allow anybody to keep on stretching it. It will get worse. Okay. Movement within your tolerance by yourself without forcing is okay. But no force. So we have two kinds of exercise. One is called PT and one is called movement. Physiotherapist is where they will try to do strength and stretching. We don't encourage that. What we want to encourage is function. So that is the job of occupation therapist. So Mr. Salakumar from now onwards will actually make sure that all of you learn the exercises for the good positioning and how to maintain function. Function is more important. If we do too much stretching and too much exercise for strengthening, we can damage. No, not that. For the flare up switch. He keeps it with him. Yeah. I just want to make sure that everybody has at home. Because by the time you get the doctor to give permission, the time is gone. So starting, I don't even mind if you take one dose and then call me. Because that's okay. One dose is taken, 24 hours you won't take it.
Calculation by weight and tapering and all we should do, madam.
We are going to do it, coming to that.
That is little confusing in the they say don't do it.
Yeah, coming to that. So the other thing we were talking about toe deformity. You're asking me what other toe deformities there are. Can you see the other toe deformities? One child only has short toe. There is no bending of the toe. Another child has no big toe. The toe is last bit of the toe is missing. And here you can see the toe is not short at all. It is long actually. But when we take the X-ray, then one phalanx alone is seen. Okay. So this child can easily be missed because he doesn't have a short toe. This child can be missed because it doesn't have a toe turning inside. So that's why when you have other symptoms like swelling and stiffness, don't go by toe alone. Both are required. If there is a doubt, if you suspect, treat like FOP, but then get a confirmation. Because I just had a child from Afghanistan, so she was diagnosed as FOP by, I think, Dr. Clive, and he started giving advice for the dental treatment as if it is FOP, but actually the child, it has not been examined. So it's a girl, and they are probably not exposing the girl to anybody. So I had to do a Zoom talk with her. I made her remove the clothes and we checked. Very nice neck movement, very nice shoulder movement. And I looked at the toe, probably the first person looking at her toes, and she had normal toes. So I told her she actually has a different condition called HME. She doesn't have her. So that's why this combination, you have to check all the combinations. But if doubtful, you can still treat as for FOP, but you should confirm.
So what was the problem that they came up with? I mean, because they didn't have FOP.
So they had HME. There's a different disorder.
Wait, what
They
is
have
that?
bony swellings. They have lots of bony swellings, but they don't have extra ossifications. Those bony swellings are coming again genetically from birth,
Oh.
but they don't get the same problem. The joints are not.
No, like from the first slide where you said swelling and the
No.
combination.
That child had normal toes.
No, but so if such a person has swelling,
Yeah.
we will use it.
But no, this swelling, the neck stiffness, swellings in the back are classical. So when I see that, if I see this toe, I do the X-ray, but the X-ray is showing like a
Okay.
So I think don't go by one thing alone. That's what I'm trying to tell you.
Yeah.
You have to put everything together, and if in doubt, confirm. You can always confirm with the genetic test. So I think there are some different kinds of FOP. We don't need to go into it because I don't think anybody here has. There is one child alone who has this FOP variant, but otherwise there is BWP. So I'm not going to spend time on this. Okay. This reduction of digits or less digits are seen again. These are usually they come a little later, but the child that we have in India actually had it by 4 or 5 years ago. So it's not always true. So when do you think you will start seeing FOP? So if your child has been very protected, nothing is happening, most likely you won't see it in the first 10 years. Or if the child has had some insults, कोई चोट लगा, कभी गिर गया, कुछ हो गया तो जल्दी पता चल जाएगा। डॉक्टर ने बायोप्सी कर दिया, तो भी जल्दी पता चल जाएगा। So between 2 to 10 years you can get. You're not likely to get an FOP presentation at 6 months, 1 year and all. So it can happen if somebody starts doing interventions at that age. Always watch with surgery and always decrease movement, usually starting around the neck and bony swellings. They should make you suspect. In MRI also they can find it because MRI also shows same areas. Again the same problem happens. Doctor don't examine the patient because they're not aware of the toe problem and they do the MRI, they say oh tumor and then they start doing the biopsy. That happens very often. That happens at least 3 times I've seen MRI, biopsy and nobody's seen the toes. Because usually wearing shoes or something like that, they are not used to taking off the shoes to examine the neck because they're not aware of. So this is one of our children only, and I just leave that out. See here, can you see this child again? That again, the toe is bent sideways, but it is long toes. So what are the other things that they diagnose? Doctor will diagnose when they think. So sometimes they, especially when it's hot and warm and not yet hard, they think it's an abscess. And the neck abscess is common, so don't think it's uncommon. Though we are criticizing them for missing that one time, they see hundreds of abscesses and then only maybe one in a lifetime they'll see it. So abscesses in the neck are very common, so don't blame them that if they think that it is an abscess.
Abscess means
Pus.
pus.
Infection.
Same thing, lymphoma tumor happen in lymph node, they also present as swelling in the neck. So that is another one. Cancer tumors, that's the reason why they want to do the biopsy. Fibromatosis ये थोड़ा हार्ड सा swelling होता है, ये भी मसल्स में होता है fibromatosis, तो उसको भी मिस्टेक कर सकते हैं. Or and other swelling things like myositis, like how we are seeing only in the neck here, can happen in the first time. We have one patient whose where it's first time started in the elbow. Now, when you start first time in the elbow, there is a condition called myositis ossificans, which happens after injury. So that is a very commonly misdiagnosed. Again, everything is like myositis ossificans, except that this child has a toe problem. We didn't look at the toe problem, so we think it's traumatic myositis ossificans. So we'll do operation.
That happened in my daughter's case.
Yeah, not one. I can give you 3 examples.
Okay.
No. One child had done it in the elbow. It came back, and not only came back in the elbow, came back in the hip, and came back in the knee, and the doctor operated 3 times before he realized that, it is not, because it's just going on spreading everywhere.
Yeah.
Before they realize, and it's not some small doctor, it's one of the very, very good doctor and very famous doctor, but just that not looking at the toe, and I'm thinking that our boys wear shoes, so I'm thinking no boys and girls should wear shoes, they should wear chappals with the toes as thin. So I think that might be one of the problems. I think this I will skip because we have already said toe deformity, bony swelling, joint movementless, and anywhere ossification anywhere in the soft tissue, and crossing the joint. Normally joint cannot have a swelling crossing. If it crosses the joint, it is a problem. And you can always get genetic analysis done. We've been doing it for free, but even if you had to pay for it, it can pay only, I think it costs about 7,000 rupees for just one gene maybe. Maximum 14,000 rupees, you can get a genetic analysis. I'm going to skip this. It is just saying why this forms. So basically in the body there is a pathway which allows the bone to form. Okay. So normally it will form at a sensible rate and at sensible times. But what happens in this gene abnormality is the tap is left open. So it just keeps forming bone at the smallest stimulus, it starts forming bone. No stimulus also it forms bone. And that is why that happens. And so most of the people think that the key to that is to block the receptor. If you block the receptor, then you can stop the bone from forming. So everybody is asking me this and they're very worried about this. If my one child has it, will my second child have it? So we can say if your child has it and the child has another child, then the chance is about 50%. But if your one child has it, will the second child have it? Chances are very, very little, less than 2%. And you can find out if you have such a problem, you can find out by doing a testing at about 12 weeks of pregnancy. You can get a genetic testing done from either amniocentesis or there are several techniques they will guide you. And you can get it tested so that you can make sure that it's. So it's not something to worry about constantly and saying now what shall I do, what shall I do. It's possible to know whether you have it or not. And the chances are very, very good. Less than 2% is very good. So now what all have we learned? I want all of you to give me one thing. What can you let the doctor do and what you have to stop the doctor from doing? Yes. 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 Yeah. No, but you're just telling the doctor and he doesn't listen to you, then what will you do? So you should give him the FOP guidelines. You should carry it on your phone and you should know all the websites. See, if you go to the International Clinical Council of FOP, they have every single thing, treatment, clinical trials, everything is given there. That is the one that there are 21 doctors in the whole world who are members of this. And all of them are the ones who have a lot of experience with the FOP. To get into the clinical council, because there are only 21 allowed, you have to have seen lots of FOP and published on FOP before they let you in. So that is the reason why you should take their advice. And then you have International FOP Association. They have a website which is also very good website, which gives you all the details. And then FOP India, which Mr. Sunil and other people have created, again has lot of information. In fact, they get all the information and they keep putting the information there. And don't forget your WhatsApp group. Any new information comes, it is put on that WhatsApp. So you just have to put वो जो भी FOP का जो प्रॉब्लम होता है ना, तो आप डॉक्टर को बताएंगे और डॉक्टर नहीं समझेगा, तो आपके पास वो FOP का गाइडलाइन हमने हिंदी में भी है, आप उसको डाउनलोड करके अपने फोन पे रखिएगा। तो जब भी कोई डॉक्टर के पास जाते हैं तो आप कह भी देंगे FOP है तो उनको नहीं मालूम तो वो नहीं करेगा। तो आपको FOP का गाइडलाइन उनको दीजिएगा, और जो खास तौर पे खून लेने का, मसल का इंजेक्शन नहीं देने का, ऑपरेशन नहीं करने का, बायोप्सी नहीं करने का समझाना है। सपोज करो कोई इमरजेंसी ऑपरेशन का जरूरत है या आपको जरूरी ऑपरेशन का जरूरत है, जैसे कि हिस्टेक्टमी का ऑपरेशन कभी लेडीज को जरूरत पड़ सकता है, अपेंडिसेक्टमी का ऑपरेशन किसी को भी जरूरत पड़ सकता है, किसी को चोट लग जाए तो ब्रेन का कोई यदि क्लॉट निकालना हो तो उसको भी जरूरत पड़ सकता है, तो वो किए जा सकते हैं। यदि जब ऐसे ऑपरेशन होते हैं तो उसमें गाइडलाइंस होता है कि एनेस्थीसिया का क्या गाइडलाइन है, तो आपका एनेस्थेटिस्ट को पता होना चाहिए वो ट्यूब कैसे डालना है, मुंह ज्यादा नहीं देर से खोलना है, क्योंकि वो लोग भी आपका गला को डैमेज कर सकते हैं, वहां पे खून फॉर्म होगा तो बहुत मुश्किल हो जाएगा जॉब वगैरह में। तो एनेस्थीसिया का गाइडलाइन कैसा ट्यूब डालना है, कैसे करना है, वो सब बताना। उसके अलावा जो आपका डॉक्टर को जो ऑपरेशन करने से पहले स्टेरॉइड शुरू करना है, ऑपरेशन के बाद भी स्टेरॉइड देना है, उसका गाइडलाइन पूरा है, वो उसको फॉलो करना। नहीं करेगा तो हो जाएगा। पेट का अंदर का जो ऑपरेशन होता है उसमें कोई जरूरी नहीं कि आपको और FOP फैलेगा, नहीं फैलेगा, वो नहीं बनेगा। पर यदि आपका चोट लगता है, जैसे आपका हड्डी टूट गया है, आप वहां पे यदि ऑपरेशन करेंगे तो जरूर फैलेगा। यदि आपका नॉर्मल हड्डी टूटता है और आप उसको प्लास्टर लगा देता है तो FOP बहुत ज्यादा फैलने का चांस नहीं है। और उसी चोट को यदि डॉक्टर जाके ऑपरेशन कर देता है तो ऊपर से नीचे तक वो पूरा हड्डी बोन फॉर्म हो जाएगा। तो इसलिए चोट लगने का जहां तक कोशिश है बिना ऑपरेशन के मैनेज करना है। जो हड्डी का चोट, हड्डी का टूटना बिना ऑपरेशन के मैनेज करना। So we have said no biopsy. I think everything we have said now, except for vaccines, we have not talked about. So no biopsy, no elective operations and anesthesia, except for life saving, and when necessary, we have to do under steroids. We know that. Exercise नहीं करना. Exercise कौन सा वाला करना है? जिसमें movement maintain करना होता है. उसमें जबरदस्ती नहीं खींचना है, जबरदस्ती मसल डेवलप करने का नहीं है, वो सारा मूवमेंट करने का, उसको ओटी बोलते हैं, वो जरूरी है, वो करना है। तो सारा फंक्शन में मूवमेंट करना है। वैक्सीन्स, यदि सबको बच्चा को वैक्सीन आप सबक्यूटेनियस वाला दे सकते हैं, इंट्रामस्कुलर वाला नहीं दे सकते। तो कभी-कभी क्या होता है, जैसे बार-बार निमोनिया का वैक्सीन होता है, अभी बच्चा छोटा है इतना जरूरत नहीं है, बट बड़े हो जाते हैं तो निमोनिया का चांस खास तौर पे जब लंग कैपेसिटी कम हो जाए तो ज्यादा हो जाता है। तो यदि आप बार-बार हर साल बच्चे को नहीं दे पा रहे हैं, आप भी को नहीं दे पा रहे हैं, तो घर का बाकी लोग को ले लेना चाहिए, क्योंकि वो तो बाहर नहीं जा रहा है। यदि बाहर नहीं जा रहा है तो उसका बाहर एक्सपोजर लेने का, बाकी सब लोग का निमोनिया में एक्सपोजर है तो बाकी सब लोग वैक्सीन ले सकते हैं, तो वो ज्यादा सेफ रहेगा ऐसे। और कुछ वैक्सीन होता है जो कि सबक्यूट वाला आता है, जो बच्चे को देते हैं उसका जगह सबक्यूट वाला आता है, कुछ सबक्यूट वाला नहीं होता, जैसे कि पर्टूसिस वगैरह का, उनमें घर वालों को लेना चाहिए। कोई भी इन्फेक्शन हो, कोई भी फीवर हो,